So first of all, to really understand a partial knee replacement, you have to have a good understanding of a knee replacement. And we talk about knee replacements, and I think most people have this conception that you go in and you lop off part of your bone with a saw, and you somehow put a big metal piece on one side and a big metal piece on the other. But really, that's far from what we do. And this is an example of a model of the end of the bone. And I'll go over here, and this is the way a knee would work, just as an example to start out with. And in this model, the cuts have been pre-made, and the knee is more of a surface replacement. So here's the cuts that we would normally make on a knee replacement. You just take a little sliver of bone off the top, and you take a little sliver of bone off the end. All the ligaments and the muscles that are surrounding the knee are left untouched. And over this surface that you create, you put a metal piece. This is plastic, but you put a metal. So we call this more of a surface replacement. And you can see that in this example, it replaces the entire surface of the end of the femur. Well, a partial knee replacement comes into play in a situation in which instead of having arthritis in the entire joint, you only have arthritis in part of the joint. Most commonly, half of the joint, either the medial or lateral half of the joint, has arthritis, and the rest of the joint is pretty well preserved. So instead of completely replacing the joint, you replace half the joint. So if this is a model of a complete knee replacement, this is the portion that goes over the end of the femur or thigh bone, and this is the portion that sits inside the tibia or shin bone. And you can see there's a plastic insert between, and the way it articulates is so. With a partial knee replacement, what you do is, instead of replacing the entire end of the femur, you only replace half of it. So utilizing this model, this is a partial knee replacement, and this would fit on like so. And you would only put it on either the inner or outer half of the bone. And then the same thing goes through on the shin bone. You would place this on half of the shin bone. So rather than replacing the entire knee, you only replace part of the knee. The advantages of that are, by virtue of taking off less bone and only replacing part of the knee and maintaining a few more soft tissue structures, the knee feels normal. People feel like it's their own knee. When you do a knee replacement, it's not that you have any residual pain, but ask anybody with a knee replacement, they have the sense that it's an artificial knee and it's not their own.